Hi, everyone. Welcome to our training on Medicaid options and community partners presented by HIC. We have provided a similar training in the past, and after some feedback from clinics and hospitals throughout the state, we wanted to provide updated information. The Medicaid landscape within Colorado has shifted over the past few years, so this training will provide some updates on Medicaid, some different Medicaid programs that have been added, and also the community partners that can help you navigate Medicaid. This is the first training in a series of trainings, so please visit our hospital landing page on the HICPUB website for details on future trainings. You can also submit suggestions on topics for future trainings or areas where you or someone in your region would like more resources on. Information on how to do that will be at the end of this training. We value and appreciate your feedback as you guys are on the front lines, and we want to know how to best support you, so please go and fill that out when you can. Details on how to access that will be at the end of this presentation. Thank you so much for joining us. And now here is the training. First, our mission at HICPUF is improving health care equity, access, and outcomes for the people we serve while saving Coloradans money on healthcare and driving value for Colorado. Let's get into our agenda. The agenda today is going to be focused on Health First Colorado, which is Colorado's Medicaid program. We will focus on HCBS, home and community-based services, which include long-term services and supports, LTSS, which provides services to people who may need additional supports and are those who may have a medical disability and or certain medical condition. We will then focus on 3 different community partners that can support both Medicaid members and clinical team members with navigating Medicaid and some non-Medicaid community resources. Those would be ADRCs, Aging and Disability Resource Centers, which may include the AAA's, Area Agency on Agings, and then we'll focus on CMAs, the Case Management Agencies, and then last but not least, Regional Accountable Entities, also known as the RAIs. While we are working to meet the need of those who are aging and may have disabilities, we also want to align our work with preventing unintentional discrimination against those with disabilities and prevent unnecessary institutionalization. We're trying to do that by providing this training and working on various other programs throughout the department. This goal is being met by providing training and additional resources to those who work with individuals and families who are at risk for institutionalization and chronic rehospitalization. HICPUF is currently working on projects directly with our community partners, nursing facilities, Medicaid members, and other members of the community to provide education around resources that are available that can support people with disabilities with remaining in the community safely if that is their choice. We understand that there are situations where individuals may need the care being provided in a skilled nursing facility or assisted living, for example, and we want to support that transition as well. This training is just to provide information to help fill any gaps in education and help streamline the discharge planning process. Let's get into it. The goal. Everyone knows that Medicaid in every state can be very overwhelming to understand at times. We're here to provide support to ensure that hospital teams, outpatient clinical staff, and community partners throughout the state have a base level understanding of Medicaid options within Colorado to support discharge planning efforts and prevent unnecessary institutionalization. This training will familiarize you with the resources available during discharge planning and teach you how community partners can support Medicaid members during and post-discharge. Like we talked about earlier, if you would like to go deeper into learning about Medicaid, please let us know what you would like training on, and we will certainly try our best to provide that. And then also on every slide for the various topics, you'll see links on the bottom of those slides that will take you directly to the page where you can dive deeper into information, as this information in the training will just start to scratch the surface. All right, Health First Colorado, which is Colorado's Medicaid program. When we look at these services as a pyramid, also known as the benefits pyramid, as we like to describe it as, we can see that the state plan on the bottom is the most widespread level of services and generally covers the most people. The state plan is standard Medicaid that most people think about when they think about Medicaid. That includes things like outpatient care, dental services, physical therapy, occupational therapy, and much, much more. As we move higher into the pyramid, the services support a more specific population with more individualized services to meet their unique needs. Long-term services and supports, LTSS, include a set of benefits that can be provided in someone's personal residence, in a skilled nursing facility, and in the community in assisted living, for example. Some of these services that are included in LTSS include home health, PACE, Program of All-Inclusive Care for the Elderly, that we'll definitely talk about later, the home modification, homemaker services, personal care, and much more. At the highest level of the pyramid, we have home and community-based services, HCBS, which are also known as the waivers, which we'll dig deeper into later in this presentation. This section of Medicaid benefits include participant-directed services that are individualized to meet the needs of the person receiving benefits, which can include transition services to move someone from a skilled nursing facility to a less restrictive living environment if the person wants to move out for a higher quality of life. Individuals receiving services at this level of the pyramid can also receive the levels of services below them. For example, an individual who is receiving services through an HCBS waiver is also able to receive services through the state plan as long as those services are not duplicative. Medicaid programs. The benefits pyramid of Health First Colorado is actually comprised of over 20 different Medicaid programs. Now, I won't bore you with all the details of all those programs. We will just talk about just a few of them. But there are some programs that provide additional LTSS services to help people remain safe in their chosen living environment. Other programs like the Medicare Savings Program, which we actually don't cover in this training, are designed to be secondary coverage to Medicare to cover its premium and other out-of-pocket expenses. Again, please look at the link at the bottom of this slide if you would like to learn more about all of the programs that Medicaid offers. We will cover some of the programs that could support those who are discharging out of a medical facility. If you would like more information, again, look at that slide. But the first program we're going to look at is Health First Colorado, which is the state plan for Colorado, which some people think of as the standard Medicaid program for Colorado. This Medicaid program is for anyone who qualifies and does not require applicants to have any specific medical condition and/or disability. The next one we're going to look at is intermediate care facilities, also known as ICF/IDD, and this is for individuals with intellectual and/or developmental disabilities. It is a residential facility that provides habilitative, therapeutic, and specialized support services. They provide supportive care and nursing supervision under medical direction 24 hours a day. They stress rehabilitative therapy that enable individuals to return to a community setting when appropriate. A full range of medical, social, recreational, and support services are also provided through this program. To be eligible, someone must qualify for the ICF-IDD level of care as determined by their case management agency. They have to be 18 years of age or older and meet financial requirements. Next is Home and Community-Based Services, HCBS, which is institutional level of care for those who prefer living in the community. We will dive deeper into this in the next few slides, so I won't go over too many details on this slide. Then we have the Medicaid buy-in program. There are two programs that are considered under Medicaid buy-in, and I am personally excited to tell people about these two programs as I think that they are underutilized. The two buy-in programs were designed to let individuals with disabilities who are over income for the state plan Medicaid buy into Health First Colorado by paying a premium. If someone works and earns too much to qualify for Health First Colorado, or if they have a child whose caregiver is over income for the state plan, then they can possibly qualify for the buy-in, which has a much higher income limit, and they would pay a monthly premium to buy into Health First Colorado to receive those benefits. The premium is based on just the applicant's income for adults and then the caregiver's gross income for children applying for the children's buy-in. The buy-in program for children with disabilities is for youth aged birth to age 19. They must have a qualifying disability and meet the income guidelines. The one for adults is working adults with disabilities, and that is actually for anyone starting at age 16 and older. They must be employed, which includes self-employment or 1099, formal employment, which is W-2 or other forms of employment, or they can be employed informally by a family member. The applicant must have a qualifying disability, and just an example of the income in 2024's income limit, that individual could possibly earn up to a gross monthly income of $11,020 and still qualify. The income limit is based solely on the applicant's income, regardless of their living situation, marital status, or tax filing status. So that is another way that sets this program apart from the state plan Medicaid. Please keep in mind that income limits may change every year. So please take a look out what that income limit is for each program by the year. All right, the next one we'll go over is PACE. Program for the All-Inclusive Care for the Elderly. PACE is another program that provides support to those who wish to live in the community. This program is for those 55 years of age or older. It is designed to meet the needs of each participant across all care settings, 24 hours a day, every day of the year. Services include primary care, therapeutic, recreational, restorative therapies, socialization, personal care, dining, and care coordination. And then we also have nursing facility, which is an institutional level of care for those who prefer to live in an institutional setting. Then some other Medicaid programs, and these are options for non-citizens. In Colorado, we have seen an influx of non-citizens seeking medical treatment and medical insurance for various conditions. If someone is a qualified non-citizen, they're generally eligible for coverage through Medicaid or Health First Colorado in the Children's Health Insurance Program, CHP Plus, if they meet state income and residency rules. To get Medicaid and CHP Plus coverage, many qualified non-citizens, such as many lawful permanent residents or LPRs, have a 5-year waiting period. This means they must wait 5 years after getting qualified immigration status before they can get the state plan Medicaid and CHP Plus coverage. There are exceptions to this. For example, refugees and asylum seekers don't have to wait the 5 years. Qualified non-citizens who haven't yet met the status of their 5 years generally qualify for marketplace coverage, which we'll talk about later in this presentation. The term qualified non-citizen includes, but is not limited to, LPRs, legal permanent residents, some asylum seekers, some refugees, survivors of trafficking, and Native American tribe members. If you are curious if you have met the 5 years, haven't met the 5 years, or if you're qualified non-citizens, please still apply for Health First Colorado if you have questions, and they can definitely answer those questions at that time. At HICPUF, we want to ensure that we are supporting every Coloradan, including those who are non-citizens. Some of the programs that can support this population include EMS, Emergency Medicaid Services, and Cover All Coloradans, which is brand new to the state. First, let's look at EMS. This covers family planning, family planning related services, and emergency services for those who are eligible. People who may qualify include but are not limited to DACA, Deferred Action for Childhood Arrivals, recipients, people without legal immigration status, non-immigrant visa holders such as tourists or students, and adult legal permanent residents who have not met the 5-year bar for the state plan Medicaid. Now, the brand new program Cover All Coloradans, which started on January 1st of 2025 in Colorado, is one that expands the health coverage for children and pregnant persons regardless of immigration status. This is a brand new program that we're excited about, so please look at details at that link. And then Connect for Health Colorado is separate from Health First Colorado, so I do want to highlight that, but it is Colorado's healthcare marketplace that was created due to the Affordable Care Act of 2012. This marketplace is for anyone, citizen and non-citizen, to shop around for health insurance coverage. One program available through Connect for Health Colorado is Omni Salud. This program is designed for anyone to apply regardless of immigration status. This program does have a premium, but once a year they open it up for the premium exemptions, but that is capped, and please look at the website for more details about that. Ways to apply for Medicaid. When someone applies for Medicaid, they're actually applying for all of the Health First Colorado Medicaid programs within Colorado. So you only have one application for every program that we're talking about today. When you apply, you will be assessed for the highest level of Medicaid that you are eligible for. For example, if someone marks that they are disabled, then they are eligible to be reviewed for eligibility for the LTSS, long-term supports and services, HCBS, home and community-based services, the Medicaid buy-in programs we talked about, and also nursing facility coverage. We ask that everyone apply however it is easiest for the applicant. Applications can be submitted online, in person, or by mail. If an individual applies online via PEAK, they can get real-time eligibility, RTE, which is also immediate eligibility decision. And just keep in mind, this is only available for medical assistance, so it may not be available for food assistance. If they complete a paper application, it can be submitted in person to a County Department of Human Services, DHS, the MA site, which is Medical Assistance Site, a CAS site that we'll talk about in a second. You can submit it via mail or by fax. Some DHS offices require scheduled appointments to speak directly with someone in person, but anyone can drop off an application and receive a receipt without an appointment. Medical assistance sites, MA sites, are places certified to accept and process medical applications. MA sites are often hospitals or other locations which require the applicant to be a current or past patient. Then we have CAS sites, Certified Application Assistance Sites. These are community-based organizations and or nonprofit organizations that can support individuals and or families with applying for medical assistance in Colorado. To find your local Department of Human Services, Medical Assistance Site, or CAS site, please follow the link labeled Application Assistance Site Locator on the HCPF webpage, and that can be found on the link at the bottom of this slide. Then anyone can mail in their paper application if they wish to anyone can mail in their paper application or complete a paper application and drop it off directly at DHS. Just keep in mind, if you mail in your application, you may not receive a receipt. All right, and then a helpful link, just so people have it, excuse me, this slide provides links various applications that you can send to anyone to complete. Please keep in mind that applications never expire. So if you fill out a paper application that has since been revised, you can still complete it and review it, as the county must still process every application that's received if it's completed. There are some applications that are available in English, Spanish, or large print. If you're working with someone who is applying for a Medicaid program that requires applicants to have a qualifying medical condition, you can use the listed disability application. The disability application can be submitted the same way you choose to submit the financial application that we talked about earlier on the last slide. With the disability application, please make sure that it is completed in full. If there is a section that does not apply, please mark it as not applicable or NA. If there is a section that is left blank, then it could cause a delay in processing. This disability application is not needed for someone who is already approved for SSI, Social Security Supplemental Income, or SSDI, Social Security Disability Income. The disability application may be required for anyone applying for HCBS, LTSS, the buy-in programs, or nursing facility. Those programs may also be known as long-term care application programs. Processing times. The state gives each county the requirement of completing medical assistance applications within either 45 days and 90 days. Please note that there are different time frames for other public assistance programs such as cash and food assistance. Cash and food assistance do not follow these time frames. Applications where there is not a disability requirement or the applicant has already verified their disability, then the county has 45 days to process that application. For those applicants that also need to submit a disability determination, those applications have a window of 90 days to be processed from date of application was received to the date of determination. Disability determinations can be made by either Social Security Administration, SSA, or the State Disability Contractor, ARBOR, who reviews the disability applications. If you do need a disability application, submit it with your financial application to DHS, and DHS can make sure that it gets to the appropriate party to be reviewed. Now, keep in mind, anyone can apply for SSI or SSDI at any time with the Social Security Administration. If the applicant does apply for either SSI, or SSDI while also applying for medical assistance, then they may also be asked to complete a disability determination on top of that for ARBOR to review, as Social Security Administration may not be able to review that application in time. Once applications are reviewed, then the technician at DHS, Department of Human Services, will send a verification checklist, also known as a VCL, to the applicant. Most of the time, this is done via mail, so make sure your address is correct. Once verifications are submitted to the technician at DHS, that technician has 10 business days to review them. If you or someone else on your team is experiencing delays in applications being processed or items being reviewed, please submit an escalation request that we will talk about at the end of this presentation. Home and community-based services, HCBS waivers. Now, before we dig too deep into LTSS and HCBS, let's think about the benefits pyramid that we spoke about earlier. The bottom of the pyramid was a state plan, which, we already covered. If we think about the middle of the pyramid, we see LTSS, which is also included in HCBS waivers, which is at the top of the pyramid. So let's focus on that middle part for this slide. The LTSS, long-term services and supports, can be medical and non-medical services that helps people who have disabilities and medical conditions with their daily activities of living. LTSS services can be provided in a person's private residence, an independent living facility, assisted living, or in a skilled nursing facility. Some of the more common services that are included with LTSS are personal care to help with ADLs, activities of daily living, such as bathing and dressing and eating. It also includes in-home health care to help with any long-term or acute condition, home modification, and homemaker services. This is just the tip of the iceberg. as there are many more services. Please check out the link at the bottom of the slide to view the program in full to see everything else that may be available. Now let's look at the very top of the pyramid that we talked about, which includes benefits from both LTSS and the state plan sections. One thing to keep in mind is that each state will have a different set of HCBS waivers. So medical facilities close to our state's border may have to also become familiar with our neighboring states' Medicaid waivers to support discharging patients. In my experience, some neighboring states will have case managers through their Medicaid programs that could help guide you if you need support with some of these discharge planning efforts. In Colorado, we have 10 total waivers. That includes 6 for adults and 4 for children. Each waiver was created to support a specific group of medical conditions and age ranges. Then, based on the need of that population, you will see different LTSS services being available for each waiver to meet the needs of that group. We will go over each waiver in brief overview, and please don't feel the need to memorize all of this information. This is just to give you informative information and give you an idea of what is available to patients who would like to remain in the community. Something to keep in mind is that each waiver has a 5-year life cycle, so you may see some changes for these in the next few years. First, let's look at the BI waiver, brain injury waiver. This is for individuals 16 years or older who are diagnosed with brain injury. This waiver has 20 different LTSS services, which include assistive devices, medication reminder, independent living skills training. Then we have the CMHS waiver, Community Mental Health Supports waiver. This is for anyone 18 and older diagnosed with a major mental illness. This one has 14 LTSS services, including alternative care facilities, peer mentorship, personal emergency response systems. Then we have the CIH, Complementary and Integrative Health waiver. This one is for anyone 18 and older with a spinal cord injury, MS, multiple sclerosis, spina bifida, muscular dystrophy or MD, or cerebral palsy, or anyone unable to move about independently. This one includes 15 LTSS services, which include but are not limited to respite, life skills training, complementary and integrative health services such as acupuncture and chiropractic and massage therapy. Then we have the DD waiver, developmental disabilities. This one is for anyone 18 plus with an IDD, intellectual or developmental disability, or anyone who needs access to help 24 hours a day to live safely. So this one has 13 LTSS services available, which include benefit planning, rehabilitation services, or residential, and pre-vocational services. Then we have the EBD waiver, elderly, blind, and disabled. This is for anyone 65 or older with exception physical impairment who are 18 to 64 years of age. Blind or physical disability, age 18 to 64, and anyone with an HIV or AIDS diagnosis. This one has 15 LTSS services, including adult day services, personal emergency response system, also known as PERS, home modification, or in-home support services, IHSS, which we will talk about in the following slide. And then we have SLS waiver for anyone, supportive living services for anyone 18 or older with IDD or who live independently or in their home with support. This one comes with 24 LTSS services, including assistive technology, behavioral services, specialized medical equipment, and vehicle modification. Now let's move on to the children's waivers. CLLI, Children with Life-Limiting Illness Waiver, is for anyone ages 0 to 18 or anyone who can be safely cared for in the home. This one comes with counseling, bereavement services, expressive therapy, and palliative care. And then we have the CES, Children's Extensive Support Waiver. for anyone aged 0 to 17, or anyone with severe developmental delay or developmental disability or intensive behavioral or medical needs. This one has 11 LTSS services, including Community Connector, Parent Education, Adaptive Therapeutic Recreational Equipment. Our CHIRP waiver, Children's Habilitation Residential Program waiver, is for anyone aged 0 to 20 with an intellectual or developmental disability or anyone at risk for out-of-home placement. This one includes wraparound facilitator, habilitation services, communication services, independent living training, supervision services, and self-advocacy training. CHCBS is the Children's Home and Community-Based Services. This is for anyone with significant medical needs. This one includes case management services and the wellness education benefit that we will also talk about here shortly. So HCBS waivers, a little more about the waivers. States can develop home and community-based services waivers as an alternative to institutional care. This allows people to receive similar long-term care services in their home and supports in their private residence or in community setting, instead of an institutional setting like the nursing home. Ultimately, HCBS allows people greater choice in how and where they receive these services, which gives them more independence and empowerment over their own lives. Members can only be enrolled in one waiver at a time, even if they're eligible for multiple waivers. The member will work with their case manager to choose the best waiver for their situation. If you would like more information about these services or want more reading material for this upcoming weekend, please check out the links on this page. Each waiver provides a unique set of services available, and it can be hard to determine which option is best for the member. On this slide, we will see multiple comparison charts so people can determine what option may be best for them. If this seems overwhelming in any way, please just contact your case management agency and they can walk through this with you. All right, now let's talk about some of those specific benefits under LTSS. So in-home support services, IHSS, lets the member direct and manage the attendants who provide their personal care, homemaker, and health management services through a certified agency. This service is available through some of the HCBS waivers and can include personal care, which includes assistance with activities such as bathing, dressing, and eating, health maintenance, which includes assistance with skilled health-related activities that are typically provided by a certified or licensed attendant, such as a CNA, certified nursing assistant, LPN, or registered nurse. It also comes with homemaker services, which includes assistance with general household activities needed to maintain a healthy and safe living environment, such as housekeeping, meal preparation, and laundry. The member would work closely with their case manager to determine what services they need. The member would direct and manage the care by interviewing, selecting, and training the attendants who help them. The IHSS agency would hire the attendant, provide 24-hour backup services, and provide supervision and oversight. A similar program that is slightly different is called CDAS, Consumer Directed Attendant Support Services. This lets you direct and manage the attendants who manage your personal care, homemaker, and health maintenance services rather than working through an agency. So this is where all of that power is in your hands. Through CDAS, you are empowered to hire, train, and manage attendees of your choice to best fit your unique needs, or you may delegate these responsibilities to an authorized representative. CDAS is available in the following HCBS waivers: the BI, CMHS, CIH, EBD, or SLS waivers. The Wellness Education Benefit, also known as WEB or WEB. This is brand new to the state of Colorado, so this is really exciting. This one currently is only available through CHCBS, the Children's Home and Community-Based Services Waiver. That's a mouthful. And the web is anticipated to be available in services and all waivers later in 2025. So keep an eye out for that. The wellness education benefit is designed to reduce the need for a higher level of care by offering educational materials that provide members with actionable tools that can potentially slow the progression of their medical condition, increase community engagement, and reverse isolation. This is being done by having short articles mailed to the enrolled member monthly. The member will receive an individualized set of different articles each month. Currently, Colorado Department rules and regulations state that a member who is approved, for HCBS will lose those benefits after being hospitalized for only 30 days or more in the state of Colorado. Before WEB, that would create a disruption in their HCBS benefits, possible termination, and the need to reapply post-discharge. This occurred due to the theory that the member couldn't utilize their HCBS benefits while hospitalized. Those who are enrolled in WEB will be considered active in their HCBS coverage and may not lose their benefits while having an extended hospital stay. This is huge. If you are working with a patient who is being hospitalized for an extended stay of 30 days or longer, please contact their case manager or have them contact their case manager to request this benefit to possibly prevent a disruption in those services. This will prevent the need for the client to have to reapply post-discharge. PACE, Programs of All-Inclusive Care for the Elderly, provides comprehensive healthcare services to their participants. One of the main objectives of the PACE program is to enable older adults to live in the community as long as medically and socially feasible. It is designed to support those who are currently living in the community and is not available for anyone living in a skilled nursing facility. One thing to note is currently PACE is only available in 16 of the counties in Colorado. A PACE organization is responsible for providing transportation to its facility from the home or the community, care that meets the needs of each participant across all care settings, and then they are also available every day of the year. Services must be furnished in at least the PACE center, the home, or the inpatient facility that it supports, up to and including to an admission to an acute care facility when the PACE program can no longer support the participant safely in the community. The PACE center includes primary care clinic, areas of therapeutic recreation, restorative therapies, socialization, personal care, and dining. And then they also provide care coordination to help members direct all of their care. Transition coordination. Targeted case management, transition coordination, TCMTC, is an optional benefit available to those who are currently approved for Medicaid. The benefit provides transition coordination by Transition Coordination Agency, TCA, who wish to transition for those who wish to transition into a community setting from an institutional settings. These services may also be available to those who are hospitalized based on eligibility. That could include transitioning to assisted living, independent living, private residence, or with family and/or friends. The benefit includes comprehensive assessment for transition, community risk assessment, development of a transition plan, appropriate referrals to set up those services and supports, which may include LTSS services. They also monitor and follow up with all these activities. This program has been shown to improve the members' quality of life and provide increased housing options for people with all types of abilities as they have access to housing supports and that may not be available to the public. One important aspect of TCMTC is that the TCA will follow the member 1 year post-transition out of an institutional setting to ensure that they are available to provide additional services as needed and available in order for the member to remain safe in the community. Now, transition services is a similar benefit for someone transitioning into the community from an institutional setting for someone who is already approved for HCBS. The member would be eligible for all of the TCM/TC benefits, plus 4 additional benefits. The first is providing necessary household items, which may include but are not limited to providing furniture, pots and pans, and other household necessities. Transition services also includes meal delivery, assistance with managing tasks such as paying bills, and peer support when available. Something to note is referral to transition services or TCM/TC does not guarantee transition into a community-based setting. All right. So now we have our AAA's, Area Agency on Aging, and ADRCs, Aging and Disability Resource Centers. So this is a map of the ADRC and AAA regions throughout the state. A lot of times the AAA and ADRCs work out of the same agency. Some counties have them split, but for the most part, most of them are intertwined. So if you need to contact a AAA, you can also contact the ADRC or vice versa, and they can direct you appropriately. So first, let's focus on Area Agency on Aging, also known as AAAs. These agencies provide local programs and services to older adults and their caregivers. AAAs were established under the Older Americans Act in 1973 to respond to the needs of those who are age 60 and older throughout Colorado. AAAs plan, coordinate, and offer services that help older adults stay safe in their home by providing various services and education. Each AAA offers different services that are tailored to their region. Most of the AAAs offer resources such as transportation, in-home services, elder rights advocacy, caregiver programs, and life skills training, for example. These agencies are supported by the State Unit on Aging, who also oversees some programs for caregiver support, legal assistance, long-term care ombudsman if you need advocacy, and the ADRC. All right, so what are ADRCs? Aging and Disability Resource Centers. They're very similar to AAA, so they do support those 6 years and older. The difference is ADRCs also support people who are aged 18 and older who have a disability. ADRCs provide services that are ran out of the region's AAA, or they may be a separate agency that we talked about earlier. Both AAAs and ADRCs support both Medicaid and non-Medicaid members, so you don't have to have Health First Colorado to utilize their their services. ADRCs support individuals in planning for their future long-term services and support needs through options counseling. This will change to individual inReach starting in July 2025. While AAAs and ADRCs can provide information on Medicaid and non-Medicaid services and resources, case management agencies can provide only information on navigating the LTSS and HPS programs within Medicaid. So essentially, AAAs and ADRCs can help provide the non-Medicaid services, both throughout the state and locally. So case management agencies, also known as CMAs. One thing to keep in mind is the state of Colorado just completed phase 3, which was the final stage of the case management redesign at the end of 2024. This process combined the single point entities, SEPs, and community center boards, CCBs, into one agency called CMAs, case management agencies. After this redesign process, people can now be served by the CMA in their area, regardless of their age, disability, or waiver that they qualify for. There are now 20 service areas that are organized by counties. If you go to the link at the bottom of the slide, you will see an interactive map that gives you all of the contact information for the CMA in your county. So what do the CMAs do? We definitely will not go over everything that they do because it's very involved, but let's talk about just some of the things, the major things that they do, which is determining functional eligibility to access home and community-based services, HCBS, and long-term services and supports, LTSS, while DHS determines financial eligibility. So they work hand in hand in with DHS. They also coordinate with other community partners such as RAISE, which we will talk about next. But the CMA can help individuals navigate the application process and implement services once approved for Medicaid or Health First Colorado. They assist with the development of a person-centered service plan by assessing the needs, goals, and desired quality of life of the member. The case management agency will then create a service plan off of that. CMAs complete intakes, service coordination, and termination of services when needed. The CMA will complete routine contact with members regularly and monitor and adjust services as needed according to the member's changing needs. Once the eligibility process for the waiver is complete, case managers assist with developing the service plan. The service plan should address a participant's needs for their activities of daily living, such as dressing, eating, and bathing, that were identified in the ULTC 100.2 assessment, also known as the level of care, as well as their goals and preferences for living in the community. Case managers should make this process as person-centered as possible, allowing the participant to have as much choice and involvement in the decision-making process. Case managers maintain regular contact with participants to ensure that they are receiving the services they need and make adjustments as needed. One important thing for hospitals to know is that CMA should have a memo of understanding with different agencies to include hospitals, behavioral health agencies, the AAAs, ADRCs, the MA sites, medical assistance sites, and law enforcement. A memo of understanding is outside of the contract for each CMA, but it's simply a formal document that the CMAs use to formalize the communication process between those entities and the CMAs. So if you have any specific questions on how to formally contact your CMA, you can definitely ask for that memo, or you can just contact them directly for more information. RAISE, Regional Accountable Entities. Awesome. So these next few slides, I'll go over the different RAI regions because similar to CMAs, they are in the redesign process. So this is the current map that we will utilize until June 30th of 2025. You'll see that there's 7 different regions. The link at the bottom will show you those 7 regions. Currently, they're in phase 2. So if we go to the next slide, this will be ACC phase 3, and these are the proposed regions. So they are going to move to 4 different regions. And the 4 regions will be effective with ACC Accountable Care Collaborative phase 3, which will go live July 1st of 2025. The role of the RAI will be changing slightly, so please go to the link at the bottom of this slide for more of that information. But before you do, let's go over some of the information about the RAIs. RAIs can support anyone who is already approved for Health First Colorado. Their main function is care coordination, where they focus on patients with acute, high risk, and/or complex needs. The majority of referrals for RAIs will be sent by members of the discharge team to help coordinate Medicaid benefits, but they can be sent directly from the Medicaid members themselves. They can help with locating outpatient providers and support referrals to those providers. As RAIs support those with complex needs, anyone who is approved for Medicaid can utilize their benefits. The main function of the RAIs is to connect the member with primary care providers, specialty care providers, behavioral and mental health care providers. While the aim is to eventually approve care, much of the work is largely administrative and behind the scenes. The RAIs are attempting to launch their programs without disruption to services for members as they implement ACC phase 3. Some of the behind the scenes work is directly with providers to improve the processes and pay for performance structures to improve the services being provided to the members. Their responsibilities. They have obligations to the members and providers and to the department. This slide provides an overview of some of those responsibilities. The responsibility that they are mostly known for is to develop and maintain primary care medical providers to serve as medical homes for members. They also locate appropriate providers for members who accept Medicaid. They also work to reduce wait lists and support the referral process to help prevent some administrative delays for members. They engage in population health initiatives while reviewing each community's access to healthcare to address healthcare using a whole person-centered approach. They not only look at physical and behavioral health, but health equity, quality food accessibility, and access to needed resources. They can also support care coordination during and post-discharge to ensure that the member will remain safe post-discharge in their choice of living arrangement. Something that is very important for hospitals and anyone in a medical setting to also know about RAISE. If you're having any complications with Medicaid, please contact your RAI, as the RAI can be the care coordination for that. HCPUF resources. HCPUF is constantly trying to connect with stakeholders routinely to connect them with resources and receive feedback. Here are some resources that you can use. We have recently developed our For Our Hospitals website, which will go over eligibility, billing, community partner information, and training. There's also links to different insurance options. For future trainings, excuse me, those will be listed on our For Hospital website, which is routinely being updated, so please keep checking that for more information. And then soon we'll be posting a training on how hospitals and community partners can work together. And then we also have trainings available to go over different PASSAR, MDS trainings, and other provider trainings if you have any new staff that you would like to have those trainings. And then please keep in mind that we have our stakeholder engagement calendar at the link provided, so you guys can stay informed on any changes to the Health First Colorado landscape or ways that you guys can provide feedback. Thank you so much for attending this training. Please stay tuned for more trainings available.